Sir, I have made you the co-host, sir, who can share the screen and start the class, sir. Sir, your voice is not audible, sir. Can you please unmute, sir?
Yeah, I was telling that I can see that there are two polls, untitled poll 1 and untitled poll 2. Which one I have to launch?
Both you can launch it, sir.
Both I have to launch.
Yes, sir.
After the class or before the class?
After starting the class, sir. You can
Okay,
share
so
the screen,
okay,
and then start the launching call, and you can start the case, sir.
okay,
Okay, sir.
okay. Shall I start?
Sir,
Good evening, everyone. So good evening, everyone. So welcome back to another live session of ophthalmology. So this is our 90-day university prof pre-final mastery, and we are doing currently the ophthalmology subject, right? Okay. So today's the topic is disorders of eyelids part 2. So we have discussed part 1 in our previous live class, right? So today is our second part of the eyelid disorders. Okay. So today we'll be covering the topics such as lagophthalmostosis, hordeolum externum, chalazion. Okay, so hordeolum externum and chalazion we have discussed in the previous slide class as well. So we'll see in the short answers today also. Okay, we'll also see the hordeolum internum. We'll see trichiasis and we'll see the Horner syndrome. So these are the topics that we are going to discuss, and these are all the topics that have come in your previous year questions, right? Previous year university exams. Okay. So before starting of today's live class, let me just give you a brief introduction of what is Auricle. So what is Auricle? So here at Auricle, we have recorded classes, we have live classes, we have practical sessions, we have rapid revision exam modules, and we also have hard copy book set, which you can purchase from the app or from the website, right? Okay, so in the recorded classes means that you can watch your recorded videos at your convenience. So it provides you flexible learning, right? And all the videos are made with the help of the expert tutors. And it is also easier for you to conveniently revise yourself because it is according to your time. Okay, and you can watch it at any time that is suitable for you. Okay, so we also have live classes like this, and live classes is for every subjects, right? And so you can prepare your concepts. You can get your concepts cleared through the live classes. You can ask your doubts in live classes. You can ask the questions. Okay, so there are MCQs which can be asked by your tutors, right? So these live classes provide you in-depth coverage of the topics that have appeared in your previous 10-year questions or the previous 10-year PYQs, and your these live classes is held by the expert educators, right? And it provides you interactive learning. It involves live doubt clearance, it involves MCQ polls, it involves Viva questions, right? So these are the live classes. Okay, we also have express exam modules. Express exam modules is basically for your covering your entire syllabus under 20 hours, right? Because if you have your exams immediately in 5 to 7 days or 10 days or 15 days, then you want to revise your whole subjects. Okay, it is not possible to read out every line before the exam. Okay, so revision is to be done very strategically. Okay, so we have created this express exam module so that you can cover your whole syllabus under 20 hours. Okay, so this is the videos made which you can complete, which you can watch it by completing a syllabus under 20 hours. Okay, it also provides you with the answer writing skills, and it is made by the expert educators. Okay, we also have one-to-one doubt clearing session here in the live class as well, or in the app. Also you can ask your doubts. Okay. As I told you earlier, we have hard copy notes set because it is not possible to read each and every line of your textbooks. So we have hard copy note set, which is very crisp and concise, and it covers all the important topics that is essential for you. And that has appeared in your previous year questions. Okay, so it contains all the relevant and all the important concepts and topics, and it is written in a point-wise manner and very colorful and very interactive, so that you will not get bored by reading it, just like you get bored while reading your textbooks. Okay, so we also have question bank. Question bank is very essential because you have to practice questions before you appear in your exams. So it has your question banks also, it has MCQs also, and it has your subjective type questions as well. Okay, we have practical sessions videos, because uh, uh, practicals are almost for every subject. Okay, like ophthalmology, you have practical exam, you have theory exam as well. So these practical exams are very important, and it holds as much importance as that of theory. So seeing these practical sessions, you will get hands-on experience and in-depth coverage of your practical syllabus, and it will include all your bios questions, and it will give you confidence and skill that you need for the practical exam. Okay. Okay, so we have a 4 kind of subscription plan, that is foundation plan, we have advanced learning plan, we have complete learning plan, and we have ultimate MBBS plan. Okay, so these vary according to the duration of the your subscription period. So if you want to be with us for 3 months, then you can opt for foundation plan. If you want for 6 months, you can opt for advanced learning plan. If you want it for the complete year, you can opt for this complete learning plan. And if you want to be with us throughout your whole journey, throughout your MBBS study program, then you can opt for this ultimate MBBS plan, right? And in all these plans, you have pre-recorded classes, you have live classes, you have express exam modules, you have practical session, and you have question banks. Okay, so these are the benefits that you get through the subscription plans. Okay, so we will start with our today's class, right? So today's class is about the disorders of eyelids. Okay, disorder for eyelids part 2. Okay. Okay, so disorders of eyelids part 2. So first of all, we'll discuss what is lag ophthalmos, right? This is a very important question that has appeared, that has been asked in your previous university exams very frequently. And it is very important to discuss because it is because you will encounter this problem quite frequently in your clinics, right? So lag ophthalmos refers to the incomplete closure of your eyelids. Okay, so you cannot completely close your eyelids, leading to the partial or complete inability to close the eye fully. Complete or partially close the eyes fully, right? Partial or complete inability to close the eyes fully. It is a serious condition because the cornea remains exposed to the environmental factors. Okay, so lag ophthalmos refers to the incomplete closure of the eyelids. As you can see in this photo, right? You can see in this photo that the left eye of this person, is not able to close. He's trying to close both of his eyes, but he's not able to close his left eye because of this disorder, that is lag ophthalmos. Lag means to remain behind. Okay, to remain behind from something. So what is lagging? Eyelid is lagging of what? Which eyelid is lagging? The left eyelids are lagging the right eyelids. Okay, so the left eyelids are not able to maintain the pace at which the right eyelid is closing. So left eyelid does not close. Okay, so it is a partial or complete inability to close the eyes fully. It is a serious condition because the cornea remains exposed to the environmental factors. Okay, so if this left eye of this person, is not able to close, okay, because the eyelid has because eyelid is not able to close the eyes properly. Okay, it is either closing it partially or it is not closing it at all. Okay, so it is partially or completely open, the left eyes. Okay, so what happens? This cornea this cornea will remain exposed to the outside. Okay, if it remains exposed to the outside, so what is dust particles, bacteria, all the things will enter into the cornea, and it will lead to the infection of the cornea. And the infection of the cornea is known as infection of cornea is known as keratitis. Keratitis, right? So lag ophthalmos can lead to the keratitis. We'll see in the later slides what it can lead to, but just for the information that infection of the cornea is known as keratitis, and it can lead to all the things like going dust into the cornea, going dust into your eyes, because you cannot close your eyes. Even if you want to sleep, you will be falling asleep, but you cannot close your eyes. Okay, so it will be like sleeping with your eyes open. Okay, so that is lag ophthalmos. So what causes lag ophthalmos? We'll see the causes. The most important cause is the facial nerve palsy, right? So the most important cause is the facial nerve palsy. So facial nerve palsy is the facial nerve is which cranial? Facial nerve is the seventh cranial nerve, right? Facial nerve is the seventh cranial nerve. Seventh cranial nerve. So the seventh cranial nerve palsy means the Bell's palsy. Bell's palsy. Okay, so cranial nerve palsy means the Bell's palsy. Okay, so seventh cranial nerve palsy means the facial nerve palsy, and facial nerve palsy can be due to the Bell's palsy, can be due to trauma, can be due to the eyelid surgery complications, and it can also be due to thyroid eye disease. Okay, so facial nerve palsy, it like any other cranial nerve palsy. So the facial nerve supplies which muscles? The facial nerve supplies. So facial nerve supplies mainly the muscles of the face. Okay, muscles of the face, and it includes the muscles of the eyes as well. And if your eyes muscle is not being supplied properly, okay, so what will happen? Your eyes will not be able to close properly. But eyelids is able to close. Okay, eyelids are able to close the eyes because of the movement of the muscle. And if the muscle is supplied by the cranial, and if the muscle is not being supplied by the cranial nerve, okay, so the muscle will not move. If the muscle will not move, then the eyelid will not be able to close the eyes. Okay, so that is known as Bell's palsy. Very important cause of lag ophthalmos. One of the most important cause of lag ophthalmos is Bell's palsy. And it's quite common also. It weakens the muscle that close the eyelid. Okay, our eyelids are having muscle. That's why it is able to move. Okay, and if the eyelid muscles has become weakened, that means it cannot move properly, the muscle. And if the muscle cannot move properly, our eyelids cannot cover our eyes. Okay, so that is a Bell's palsy. And other causes of palsy or other causes of facial nerve palsy can be the trauma. If there's trauma to the face or your facial nerve has been dissected, okay, if you have any injury on the face, that means a facial nerve has been cut. Okay, so then can also lead to the lag ophthalmos. It can be due to the eyelid surgery complications. Okay, for example, you're performing surgery on eyelids. Okay, you're performing surgery on eyelids, and you know that eyelid the muscles are supplied to the facial nerve. And during the surgery, mistakenly you injured your facial nerve. If you injure your facial nerve mistakenly, okay, then what will happen? Lag ophthalmos can result after the surgery. Okay, the fourth is conditions like thyroid eye disease may also contribute. So thyroid eye disease can also contribute to the lag ophthalmos because thyroid disease has a manifestation on eyes as well. Okay, thyroid disease has a manifestation on eye, and one of the eye manifestation of thyroid is lag ophthalmos. That thing you have to remember. Okay, so we have discussed 4 causes of lag ophthalmos, that is Bell's palsy, that is trauma, that is eyelid surgery complication, and other is thyroid eye disease. Thyroid eye disease. Okay, so these are the 4 causes of lag ophthalmos that you have to remember. So we have done definition of the lag ophthalmos. We have seen the diagram of the lag ophthalmos, and we have seen the cause of lag ophthalmos. Okay, now we'll discuss the complications. Okay, so these are the 3 headings that you have to write your answers under if the question of lag ophthalmos come. What are the headings? First, you have to write the definition, then you have to write the causes, and then you have to write the complications. We'll also see the treatment part, right? And treatment. So these are the 4 headings that you have to write your answers under. Okay, so the cornea can dry out due to the exposure. Okay, the cornea can dry out due to the exposure because our eyes are not getting closed. Okay, so the cornea will remain exposed to the external environment. And if it is remain to the external environment, it can result to keratopathy. Keratopathy means disorders of cornea. Exposure means because the cornea is exposed to the outer environment. That's why the cornea is having some kind of disorder. So that is known as exposure keratopathy, leading to chronic irritation, scarring, or ulceration. So what can result? It can result in chronic irritation of the cornea. Okay, there can be a scar formation in the cornea, and there can be ulcers in the cornea. Okay, there can be ulcers, there can be scars, and there can be chronic irritation of the cornea. So these are the three things that can lead to the lack of thermos. Okay, and as I told you earlier, there can also be keratitis. Keratitis, and the second is exposure keratopathy. Exposure keratopathy. So these are the two main complications that can result due to the lack of thermos. Okay, so if any question comes of lack of thermos and you are being asked about its complications, then always remember there are two things: keratitis and exposure keratopathy. Otherwise, you can write in the sentences like exposure keratopathy means the cornea is being exposed due to inability of the eyelids to close your eyes. So that can be the sentences to how to frame the sentences, right? So you have to frame the sentences. You cannot write just simply keratitis and exposure keratopathy. You will get marks. I'm not saying that you won't get marks writing these 2 points, but you have to write it in sentence. That will fetch you the more marks, right? That will look like you have written somewhat 4, 5 to 6 lines about the complications. So you have to just expand the keywords, right? That's very important. You can expand by using the words like chronic irritation, scarring, ulceration. These things you have to remember. Okay. If it is untreated, this may result in permanent vision loss. Okay. So if lack of thalmos is remaining untreated, then it can result in permanent vision loss later on, because our cornea will not able to pass the light into the retina. Okay, now the treatment option, the final part of the lag ophthalmos. Okay, so what are the treatment options that are available to us for lag ophthalmos? So mild cases are managed with frequent use of lubricating eye drops. Since we are not able to close our eyes, that means our eyes are not lubricating, because whenever we blink our eyes, okay, so have you ever wondered why we blink our eyes so frequently? We blink our eyes so frequently because to protect our eyes from the external environment. So if I'm blinking my eyes regularly, that means my eyes are becoming wet and wet. Why it is becoming wet? Because on blinking of our eyes, because on closing our eyes, okay, what happens that a tear film is created in front of your cornea. A tear film is created, and the tear film will support your eyes and protect your eyes from the external bacteria or the dust particles. Okay, so that is very important. Frequent blinking, right? If you're not blinking very frequently, then you will feel some daily sensation in your eyes, right? So blinking is very necessary. So mild cases are managed with frequent use of lubricating eye drops. So in this person, it cannot blink because he is not able to close his eyelids. And if he is not able to blink, then we have to give some lubricating eye drops or some artificial tear film to protect his eyes. So one option can be lubricating eye drops or ointments. For more severe cases, surgical interventions like tarsorrhaphy. So surgical interventions is the second treatment of choice. Second treatment of choice, such as tarsorrhaphy or gold weight implantation. Gold weight implantation. So tarsorrhaphy or gold weight implantation are the two surgical techniques in the upper eyelid which can consider to improve your eyelid closure. Okay. So we have discussed three things. What is three things? We have discussed eye drops, lubricating eye drops. We have discussed tarsorrhaphy. We have discussed gold weight. Gold weight implantation. So these are the three treatment options that you have to remember. Okay, so these are three treatment options for lag ophthalmos. So we have discussed in lag ophthalmos 4 headings: definition, causes, complications, and treatment. Right? In the treatment, we have discussed mild treatment, we have discussed surgical treatment. In mild treatment, we have discussed eye drops. And in surgical treatments, we have discussed tarsorrhaphy and gold weight implantations. We don't need to discuss in detail about what is tarsorrhaphy or what is gold weight implantation, because the lag ophthalmos can be a short answer question and you have to write it in very few points, right? It is very few points, like 1.5 pages answer you only have to write to fetch 5 minutes, right? Okay, so that was all about the lag of thymus. So second most important heading is ptosis, right? So what is ptosis? Ptosis is the drooping of the upper eyelid due to the weakness or paralysis of the levator muscle. Okay, so in the eyes, we have levator palpebrae superioris muscle. So the full form of levator is levator palpebrae. Levator palpebrae superioris. Levator palpebrae superioris muscle. So this is the also known as LPS muscle. LPS muscle. Okay. So this is the muscle that you have to remember. Levator palpebrae superioris muscle. So grouping of the upper eyelid to the weakness or paralysis of the LPS muscle. Okay. So our eyelids have this muscle, or our upper eyelids have this muscle, levator palpebrae superioris muscle, and our upper eyelids droop. Why it is drooping? Because this muscle has become paralyzed. And if this muscle has become paralyzed, that means the eyelids will become permanently droop. Okay, our upper eyelids becoming droop means, I'll show it in the figure. Okay, like this. You can see in this baby's image on the left hand side, the upper eyelid has become droop. It has come to the lower level. Whereas in the right eye, it is normal. This is right and this is left. It is normal, right? In the right eye, it is normal, but in the left eye, it is becoming droop. Okay, it can affect one or both the eyes. Okay, so this is the definition of the ptosis. So definition of ptosis is drooping of the upper eyelid due to the weakness or paralysis of the levator muscle. It can affect one or both the eyes. Okay. Now, what are the causes of the ptosis? The causes of ptosis is according to the types of ptosis. Okay, types of ptosis. We'll discuss the classification. Okay, let us first discuss the classification of ptosis. Classification of ptosis includes two types: the congenital ptosis and the acquired ptosis. Right? Congenital means that is present since birth, and acquired means that you acquired in your adulthood or in your lifetime. Okay, so congenital and acquired, these are the two broad headings of classification of ptosis. And in the acquired ptosis, you have to remember the four types. Okay, the four or the five types. First is aponeurotic, second is neurogenic, third is myogenic, fourth is mechanical, and fifth is traumatic. Aponeurotic, neurogenic, myogenic, mechanical, traumatic. You have to remember these names. Okay, so just try to sit. Just
Hello, sir.
yes.
I can't see your face, sir.
Okay.
Right now, your face is visible, sir.
Okay. Is it
Okay.
visible now?
Yes, sir. Yes, sir.
Okay.
Now you can continue, sir.
Okay. So there are two types of ptosis, the congenital ptosis and the acquired ptosis, right? So congenital ptosis means that is present.
Sir, again, I can't see, sir.
Okay, I think it's because of this. No?
Yes, sir.
Okay, okay, sorry. Okay.
Okay, sir.
So congenital ptosis that is present since birth and acquired ptosis that is include the five types, right? The aponeurotic, the neurogenic, the myogenic, the mechanical, and the traumatic. Okay, so these are the five types of ptosis. The five types of ptosis that comes under the acquired ptosis, right? So you have to remember the names of these five types: aponeurotic, neurogenic. I'll write it down for you. Aponeurotic. It is written also, but it is better to write it in your own handwriting. Then you will remember it more uh, accurately, right? Aponeurotic, neurogenic, myogenic, mechanical, and the last one is traumatical. Traumatic. So these are the five types of acquired ptosis that you have to remember. Okay, these are five types, or these are the main classification of ptosis you can also say, because the other than these five types, we have only the congenital ptosis. Okay, so this was about the classification of ptosis. Now coming towards the causes of the ptosis. Okay, cause of a ptosis can be, the most important is aponeurotic ptosis. Aponeurotic ptosis means the age-related levator muscle weakening. because as you age, okay, as you move towards your 50s or your 60 years of age, that means your all the body muscles are starting to become weak. Okay, and if your muscles are starting to become weak, then your eyelid muscles are also becoming weak. And if your eyelid muscles are becoming weak, then you can have aponeurotic ptosis in your later stage of life. Okay, so that's this one type of acquired ptosis. Neurogenic ptosis means oculomotor nerve palsy. Oculomotor is a third cranial nerve. Oculomotor, it is a third cranial nerve, right? Third cranial nerve. And the third cranial nerve can lead to oculomotor nerve palsy or Horner syndrome. Okay, Horner syndrome we are going to discuss in the last topic of our today's session. So I will tell you there that Horner syndrome can lead to the ptosis. Okay, so Horner syndrome can also lead to ptosis, and Horner syndrome is what? Horner syndrome is oculomotor or third cranial nerve palsy. It is also as neurogenic. Neurogenic means the nerve palsy. Neuro means nerve, genic means palsy. Neurogenic ptosis. Myogenic ptosis means the muscle disorder such as myasthenia gravis. So myasthenia gravis is also it is an autoimmune disorder, right? It is an autoimmune disorder where what happens in myasthenia gravis, you must have studied in your second year. In myasthenia gravis, your acetylcholine receptors, it becomes auto-regulated, okay, and it destroys the postsynaptic these receptors, and sorry, it gets overstimulated the postsynaptic receptors, and what happens? Your muscles become uh, excessively it becomes excessively stimulated, and thereafter, after for sometimes there is contraction, after sometimes the muscles become weak and very fatigued. Okay, so that's what happens in myasthenia gravis. Your muscles become very weak after some period of time. Okay, so in myasthenia gravis, you can also have myogenic ptosis. If the commonly it is not seen in myasthenia gravis, but in myasthenia gravis, it can also involve your eyelid muscles. Okay, so the most important cause is Horner syndrome. The second one is the most important. Okay, so always remember the Horner syndrome part, right? Horner syndrome, myasthenia gravis, and age-related levator muscle weakening. So these are the causes of ptosis, right? Myasthenia gravis, Horner syndrome, age-related weakening. Okay. Now coming towards the correction of ptosis. Okay, so correction of ptosis means levator resection to strengthen eyelid elevation. Okay, so what can happen? Your levator palmaris superioris muscle has become loosened. Okay, has become loosened. So if it has become very loose, then what can happen? You can resect the muscle and you can tight the muscle. Okay, you can stretch it or you can tight the muscle so that your eyelids can again become elevated. Okay, so your eyelids becoming elevated. Frontalis sling procedure is another procedure for severe cases using a frontalis muscle. So what is a frontalis muscle? Here in the frontal side of your skull, okay, so there is this muscle called frontalis muscle. So frontalis muscle, what do? You do a frontalis sling procedure. You from your frontalis muscle, you create a sling. Okay, so you create a sling inside this, and you create a sling which will carry your eyelid. Okay, which will uh, lift your eyelids. Okay, the frontalis muscle will lift your upper eyelids. So that will happen in frontalis sling procedure. And you can also treat underlying conditions such as nerve of muscle disorders. Nerve of muscle disorders. Okay, so you can do levator resection, you can do frontalis sling procedure, and you can do underlying disorders such as nerve or muscle disorders. So these are the three headings. These are the three correction techniques that uh, that can be done for ptosis. Okay, so the most common is levator resection and frontalis sling procedure for severe cases. Okay, we usually do not prefer this technique because of intensive surgery requirement. So we prefer levator resection, or we used to treat the underlying nerve muscle condition that is associated with this ptosis condition, right? Okay, so we have discussed ptosis under what headings? We have discussed ptosis under like definition. We have discussed its classification. We have discussed its causes. We have discussed its um, correction techniques, right? Or treatment, you can say. Correction techniques. So these are the four headings under which you have to write your answers of ptosis. Okay. Okay. Now coming towards the next topic, this is hordeolum externum. It is also known as what? I've told you in the previous lesson, okay, I've told you in previous live class that is also known as style. It is also known as style. Okay, so hordeolum externum is also known as style. So we have discussed its clinical features. These clinical features include red, swollen, painful lump on eyelid margin, often causes staphylococcus infection. Okay, Staph aureus. So the most common causing organism is Staph aureus. Staph aureus is the most important organism causing infection of your lower eyelids. Okay, so the clinical feature includes red, swollen, painful lump on eyelid margin, often caused by staphylococcus infection. Okay, so how do you manage this condition? You can manage this condition using warm compresses to facilitate the drainage. I've told you in the previous lectures also. If you want these hordeolum externum to study in detail, because this is the very shortest equation, it will either come in your 3 or 2 or 4 marks, maximum 4 marks, right? And if it comes for greater than 4 marks, then please refer to the previous live session. There I have explained in detail about the hordeolum externum. Okay, so right now we are doing it in kind of short because this hordeolum externum has also been asked in 3 marks questions also. Okay, so we are just doing it for 3 marks right now. Okay, so this hordeolum externum, the clinical features of hordeolum externum includes red, swollen, painful lump on eyelid margins. Okay, you can see here in this children's eyes, here it is a painful swelling. Okay, you can see there is a swelling like a pimple. Okay, like a pimple, there's a swelling, and you can see that it is filled with pus. And you can also see that it looks very painful. So it is red, it is swollen, it is painful lump on eyelid margins. Okay, so most important is where it is. It is on the eyelid margin. Okay, and what is the causative organism? Causative organism is Staph aureus. Okay. Now, how do you manage this condition? You manage this condition by warm compresses to facilitate the drainage. Okay, so there, if there is drainage, then you can facilitate it by warm compressing it. Okay, and what causes this hordeolum externum? There is the infection of the which gland? Tell me which gland? Infection of the Zeiss gland or Moll gland. Zeiss gland or Moll gland. So it is the infection or inflammation or blockage of the Zeiss or Moll gland. So this gland secretes some kind of secretion, and if they're unable to secrete their secretions, that means that the secretions will remain inside the gland. And if it remains inside the gland, it will become more and more and more, and the gland will become very swollen, and it will give the appearance of this red, painful, swollen lump. Okay, so that is the build up secretions of the Zeiss and Moll gland. Okay, so what you can do warm compresses to facilitate the drainage, and you can also apply topical antibiotics, incision and drainage if any abscess is formed. Okay. Now, chalazion. Okay, now chalazion is another kind of disorder, more or less similar to the hordeolum externum. Okay, what is the difference? There it was painful inflammation of Zeiss and Moll gland, but here it is painless inflammation of meibomian gland. Which gland? Meibomian gland. Okay, so there is this difference, but there was Zeiss and Moll gland, and here it is meibomian glands. You have to remember this difference, right? So it is a chronic painless inflammation of a meibomian gland. So how do you manage this condition? You manage this condition by warm compresses for mild cases, incision and curettage for persistent cases, and intralesional steroid injection for selected patients. So first of all, you can apply warm compress. Then second, you can do IND, that is incision drainage. Okay, if it is for very chronically persistent period of time, then you can just simply cut the swelling, and you can drain out all the pus that is all the secretion of the meibomian gland that has been accumulated, and you can resuture the glands, right? Intralesional steroid injection. So where the lump has been formed, you can give the steroid injection for selected patients. It is not preferred in all the patients, right? So these are the three management techniques that you can do for chalazion. Okay. Okay, what are the complications? The complications, since it is an infection, it can reappear. The infection can reappear, okay, and it can recur or scarring the eyelid. So there can be scar formation after being treated, and there can be infection and recurrence of this infection. So there are three management techniques, one definition, and the complications. So just remember that hordeolum externum is very important, right? Sorry, chalazion and hordeolum externum both are very important, and the difference, what makes one different from the other, that is also important. The most important point of difference is the painful and painless. Which is painless and which is painful, that you have to remember. Painless is chalazion, painful is hordeolum externum, or sty is painful, right? And hordeolum externum is caused due to the inflammation of gland of Zis and Moll, and chalazion is due to the inflammation of meibomian glands, right? Okay. Now, what is hordeolum internum? So we have seen hordeolum externum. Externum is appearing on the external surface, and hordeolum internum is appearing on the internal surface, right? An infection of deeper meibomian gland. So it is an infection of deeper meibomian gland. Okay. So infection of a meibomian gland was chalazion, but infection of a deeper meibomian gland is hordeolum internum. So just don't get confused between these three terms. That is sty, that is chalazion, and that is hordeolum internum, right? This hordeolum internum is more painful. It is painful. Hordeolum externum was painful. Chalazion was painless. Internum is painful, right? It is diffuse swelling, then hordeolum externum. Management similar to hordeolum externum. Warm compresses, oral antibiotics, incision day. Management is same for both hordeolums. Management is same for both hordeolum externum and hordeolum internum. Okay, and hordeolum externum is also known as sty, and it is due to the infection of gland of Zis and Moll, and hordeolum internum is due to the infection of deeper meibomian gland. It is more painful and diffuse swelling than hordeolum externum. You can see here. In the right hand side in the image, you can see that the hordeolum internum is inside. Okay, it is not okay. The one more difference, it is more commonly seen in the upper eyelid. Hordeolum internum is more common seen in the upper eyelid, whereas in hordeolum externum it is more common seen in lower eyelid. Okay, I will write it down here. Upper eyelid more common. And in hordeolum externum, I'll write lower eyelids more common. Right? Okay. So hordeolum externum is an infection of deeper meibomian gland, more painful and diffuse swelling than hordeolum externum. Management is similar to the hordeolum externum. Okay. Now, what are the clinical features? Clinical features will be painful, diffuse swelling of the deeper meibomian glands, resulting in painful red swelling in the upper eyelids. Right. Okay. So this can be the clinical features. And management is same: warm compresses, oral antibiotics, IND, that is incision needle if necessary. So next condition is trichiasis. So what is trichiasis? Trichiasis is the inward growth of eyelashes that rub against the cornea. You can see in the image down there. Okay, you can see in the image. I will mark it with blue. Okay, just see this. Now I will rub it. Okay, just see this upper eyelid. The upper eyelids have become turned inwards. And just see the lower eyelids. In the lower eyelids, you can see it is turning outwards. Okay, it is turning outwards. But in the upper eyelids, you can see all the eyelashes are turning inwards. Turning inwards means towards your iris and towards your cornea. Okay, you can see the eyelashes are touching, and the eyelashes, the hair of eyelashes is touching your iris and is touching your cornea. Okay, so this inward growth of eyelashes that rub against the cornea is known as trichiasis. Trichiasis. Okay, so I have one more question for you. Like, what is trichobazar? Trichobazar. If you know, then very good. If you don't know, then just know this: the trichobazar is the. This is unrelated to ophthalmology, but just I feel like relevant information to give to you, that the trichobazar is the eating disorder, like the person who is psychiatrically stimulated, okay, psychotic disorder, that he's very compulsive to eat the hair. He likes to eat the hairs. Okay, so this trichiasis is the inward turning of the eyelashes, and trichobazar is the eating of hair. So And after some time, after years of eating those hair or those hair, okay, what happens? That the person's stomach becomes very uneasy and he feels very strong stomach pain. Then he goes to the hospital, right? And when he gets operated, then a tuft of hair is found in the intestines of the patient. Okay, so that is trichobiza. Okay, and trichiasis means the inward turning of the eyelashes. So the word trichia, that means always related to the head. The word trichiasis, tricho, that means it is related to the head. Okay, so it is inward growth of the eyelashes that rub against the cornea. And if it is rubbing against the cornea, that means your cornea will become inflamed. And if the cornea will become inflamed, then it will do irritation. You can see here that all the cornea, the conjunctiva has become red, like, okay, because it has been inflamed. So the symptoms include irritation, foreign body sensation, corneal damage. So these are the all symptoms that can happen due to trichiasis. Okay, irritation, you can feel foreign body sensation, and you can also feel corneal damage. Okay, so what is the treatment option? Treatment is the epilation. Epilation means removing of the eyelashes completely. So what is epilation? Epilation means removing your eyelashes. If you remove your eyelashes, then that means there is no more eyelashes present to turn inwards or to touch your cornea. There is no more eyelashes. You can also do electrolysis. Electrolysis means cutting out your this eyelashes, right? Or they can also be surgical resection. So surgical resection means you're going to completely lift your eyelids so that the all the eyelashes are projecting outwards and not inwards, right? Okay. So this was about the trichiasis. And in the trichiasis, I told you that inward growth of the eyelashes, the trichiasis, always remember the word trichia means hair, okay? And in the trichiasis means inward growth of the eyelashes that rub against the cornea. And symptoms include irritation, foreign sensation, and corneal damage. Okay. Horner syndrome. So this is the one. This is another important topic. This is Horner syndrome. I told you Horner syndrome is third law of Palsy. Okay, Horner syndrome is really third law of Palsy, which is the third cranial law. Third cranial law is the your oculomotor nerve. Okay, so third cranial nerve, Palsy. That is oculomotor nerve, right? So what are the signs of this oculomotor nerve? So, sorry, what is the signs of this Horner syndrome? Ptosis. I told you ptosis. Okay, you can see in the diagram in the first part, the ptosis means mild drooping of the upper eyelid. Okay, so we are discussing the Horner syndrome, the components of the ocular components of the Horner syndrome. Okay, so the first sign is the ptosis. The second sign is the meiosis. What is meiosis? Meiosis is a constricted pupil. Okay, meiosis means constricted pupil. And what is the opposite of meiosis? The opposite of meiosis is mydriasis. Always remember this. Mydriasis means dilated pupil. It is not seen in Horner syndrome. It is not seen in Horner syndrome, but I'm just telling you the opposite of meiosis is mydriasis, which is a dilated pupil. So, what are the ocular signs we have discussed? We have discussed ptosis, we have discussed meiosis. Third is anhidrosis. Anhidrosis means absence of sweating on the affected side. That means on the side that you're having Horner syndrome, on the side of the eye that you're having ptosis, having meiosis, that means you will not sweat on that part of the side. For example, this side is all showing the symptoms of Horner syndrome. That means I will not sweat from this side, but I will only sweat from this side. Okay, so there's unilateral sweating present. Okay, so there's anhidrosis. Anhidrosis means absence of sweating. Anhidrosis means absence of sweating. Okay, now the fourth fourth sign can be anophthalmos. Anophthalmos, sunken appearance of the eyes. You must have heard about exophthalmos. Exophthalmos means very protruding eyes. Okay, and ophthalmos means the sunken appearance of the eyes. Sunken appearance means the eyeball will appear very deeply embedded. Okay, your eyeball will appear very deeply embedded. So that is the appearance that your eyeball gives when we have Horner syndrome. So we have discussed 4 signs of the Horner syndrome, very important for the university exams: ptosis, meiosis, anhidrosis, and ophthalmos. These are the 4 very important signs that you can get in your exams in either MCQs or in your 2 or 3 marks questions, right? What are the ocular components of Horner syndrome? What are the signs of Horner syndrome? How does Horner syndrome occurs? So it occurs due to the third cranial palsy, that is oculomotor nerve palsy. Okay, so we have discussed Horner syndrome. Okay, so we have discussed all the topics that can be asked and that has been asked in the previous 10-year questions. Okay, so just let me launch the second MCQ code for you guys. This is the second. Okay. So summarizing this whole session, so leg ophthalmos and ptosis can lead to significant ocular complications if not managed properly. And I have told you what are the 2 complications: exposure keratopathy and what? Keratitis. So these are the 2 most important complications that can occur if you don't manage your leg ophthalmos and your ptosis very properly. Early diagnosis and appropriate treatment, including surgical correction, can prevent the long-term damage because these are not the very serious or very immediately demanding conditions. Okay, so if you just manage it very early, or if you diagnose it very early, then you can manage it using so many options. Okay, it is not like that you have to do surgery only. There are so many other options apart from surgeries. So conditions like trichiasis and hordeolum are generally treatable with minor procedures. Okay, so trichiasis and hordeolum are very easily treatable the disorders that can be treated with minor procedures. Okay, so we have discussed all the things that is important for you to write your answers, and we've discussed the headings under which you have to write your answers, and we've discussed all the 4 to 5 keywords in every part of the answer that you have to write. Okay, so you can see that I only focus on the keywords. Okay, and you have to frame your answers, because framing answers is not that hard. Okay, but remembering the keywords is very hard. So always just focus on the keywords, and then you can frame the sentence. It is not very hard to frame the sentence. You just have to know the English for that, nothing else. Okay, but you have to remember the keywords. Okay, so this was about the today's session. So in the next class, I think we're going to discuss about the, let me just see what we're going to discuss in our next class. Okay, so we are going to discuss about the disorders of lacrimal apparatus. Okay, so what is lacrimal gland? What is anatomy of lacrimal gland? We'll discuss all these topics in our next class. Okay, and what are the and we'll also discuss the questions and answers of the topics related to the lacrimal apparatus that has been asked in your previous year questions. Okay, so just remember this eyelid disorders is very important, and therefore we have discussed it in 2 parts, right? Because eyelid disorders cover a wide variety of questions, and it is very important to study. And just don't confuse between this hordeolum externum and this chalazion and hordeolum internum. Just remember the gland that is getting infected, and remember every disorder in the terms of whether it is painful, whether it is chronic. Treatment option is more or less the same for all the disorders, right? But just remember the painless and painful version of each disorder, and the gland that is involved in each of the disorders, right? So this was about the today's session. So I hope that you learned and you remembered all of the keywords that I tried to deliver to you. And till then, happy learning. And just if you have any questions, you can ask me. And see you in the next live class. Thank you so much. Hello. 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 Can you hear me? Hello. 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 Hello.